Next set of muscles will be the hamstring. So here's a posterior view, and we'll look at in lay terms we call them the hamstrings, but they're actually composed of 4 muscles. Okay, we have 2 muscles on the medial side and 2 muscles on the lateral side. Okay, this area also has the femur. So when we look at the first muscle of the hamstring group, we see biceps femoris, the long head. Okay, if you have a long head, that means you're going to have a short head. Okay, posterior view. All right, we have origin at the ischial tuberosity, and then insertion goes down to the head of the fibula. Okay, so from a PT perspective or a sports medicine perspective, this muscle in particular, if the hamstring is going to get hurt, it's usually this one, the bicep femoris long head. Okay, a lot of reasons for that. It crosses 2 joints. It also has a fibula head attachment, which when you run, walk, and all that, the biomechanics for the knee and the proximal tib fib is quite intimate. This has an attachment site there, and once this gets tight, and with the mechanical load that people endure when running and so forth, it's very easy to pull the hamstring. You also have to consider pelvic unleveling. So if the pelvis is uneven, which is very common, that also puts an additional strain on either hamstring. Okay, it just depends on the which way the pelvis is off-centered. Okay, the action is so because it crosses 2 joints, you're going to have some extension at the hip, and you're going to have flexion at the knee, and it's going to have some external rotation at the knee. Okay. Also look at the hamstrings like the reins of a horse. Okay, picture yourself sitting on a horse. You're holding the reins. If the reins are relatively neutral, the head of the horse stays straight. If you pull too hard on the right rein, the head goes to the right. If you pull on the left rein, the head goes to the left. The hamstrings behave like that. Ideally, you want them to be centered, okay, equal-ish in tension. But if one side pulls too hard, then it's going to pull the knee out. Or if the inside muscles pull too hard, it's going to pull the knee out that way. And now you have some biomechanical instability, and you're susceptible to hamstring injuries and or hip and knee injuries. Okay, so treatments are very effective to get the muscle to heal and calm down, level off the pelvis, level the knees, level the whole kinetic chain because of the foundation. Is the person pronating or supinating? Is one leg longer than the other? You may need orthotics or heel lift. But once you get all that figured out, the stress and biomechanical load to the hamstrings is much less, and you reduce injuries. Okay, the next muscle, which is underneath the bicep femoris long head, is going to be the bicep femoris short head. Okay, it has its origin on the femur, posterior femur, the linea aspera part of the femur, and insertion is on the head of the fibula. Okay, its action is going to be, it only crosses 1 joint, so it will be flexion at the knee. Okay, going to the medial muscles. Okay, you have, I call them the semis. Okay, the semitendinosus and the semimembranosus, which is underneath, as you can see there. Okay, the tendinosus is on top. peel that back, and underneath you will have the membranosus. All right, let's look at the semitendinosus first. Okay, it has its origin on the ischial tuberosity and its insertion on the, I'm going to turn this around, okay, on the anterior aspect of the proximal tibia around the tibial tuberosity. Okay, and keep in mind you have an anterior view here. This is the medial side, so it inserts itself about right there on the medial tuberosity. Okay, it will help with extension at the hip and flexion at the knee and internal rotation. Okay, underneath it, you have the semimembranosus. Okay, this is a posterior view. It has its origin on the ischial tuberosity and then its insertion on the tibial condyle, so the posterior aspect of the tibia. Okay, so the medial tibial condyle is its insertion. Action is extension at the hip because it does cross two joints, and the other action is flexion at the knee, and it will help with internal rotation.